So as attorneys, we get asked all the time the question of, what can I do to increase the value of my personal injury case? And the biggest thing that somebody can do to make their case better also just so happens to coincide with the thing that can make them feel better more quickly, which is getting treatment. So today we're going to talk a little bit more about those different kinds of treatment and why you may be directed by your doctor to get that treatment. Your medical treatment is the foundation of your personal injury case. So when we talk in terms of the value of somebody's injury, we have to have something concrete to tie your injury to. And so oftentimes what we tie that to really is the medical bills. So the medical costs that you actually incur as part of the treatment that you're getting to help make your body feel better. It's important that you get evaluated really early on, ideally as close to the accident as possible. So whether that's an emergency room visit, whether that's with a primary care doctor, or sort of a quick care, insta-care type of visit, we want you to seek immediate medical attention so that the doctors can review what's going on with you, your injuries, and so that we can establish a firm pattern of seeking treatment. Treatments like chiropractic care or physical therapy are often prescribed to people who are injured as sort of the least invasive way for you to get better. And so your medical provider will oftentimes suggest either chiropractic care or physical therapy as the first step in trying to improve your back pain or neck pain, shoulder pain, knee pain that happened because of the accident that you were involved in. Another important part of your care is imaging. So we want you to get imaging done as directed by your medical provider, whether that's an MRI, an X-ray, a CT scan. We want you to get imaging to sort of establish the medical issues that you're having. After you have gone to the physical therapist or chiropractor and you've had some imaging done, oftentimes the minimally invasive care, the chiropractic care or physical therapy won't necessarily solve all of the problems, and the imaging that you get will actually show some further problems. So at that point in time, oftentimes your medical provider will recommend that you go get some specialist care. So that's usually a medical doctor who has specific training. It could be a surgeon, it could be an orthopedist or a neurologist, but somebody who can help further diagnose what is going on with you after we've kind of gone through the normal protocols for medical care as recommended by your medical provider. Another part of an accident that really oftentimes goes unnoticed is mental health. We have pretty regularly complaints from our clients that they have post-traumatic stress disorder, where they get into a car and it freaks them out because they're always looking around to see if somebody else is going to injure them, or in the case of like somebody who fell down a stairwell that wasn't properly built and the stairwell collapsed. They have PTSD every time they go down the stairs. They have trouble sleeping at night. They have irritability. And so in addition to care for your physical body, we also want you to get care for your mental health. And in some cases, that's a very, very important part of the care that your medical provider will tell you to seek to receive. Finally, there's what we call long-term care. So there's something called maximum medical improvement. So your body can only improve so much in a period of 1 to 3 or 4 years. And at some point during your treatment, you may have your doctor tell you, well, this is really as healed as your back or your knee is going to be. At that point, they may recommend that you have sort of long-term treatment. So for back pain, that may be injections or future surgery. That may be future physical therapy. That may be future mental health care. And so as part of your settlement, when we're looking at the totality of all of your medical costs and the medical care that you've received, we want to factor in, before we ever settle your case, those future medical costs, that future medical care that you're going to need as part of your long-term recovery and health. Your medical care is the foundation of your personal injury settlement. And so it's very important that you seek medical consultation immediately after the accident, that you undertake to do all of the medical care that they recommend to you, that if your medical problems aren't improving, that we get some additional imaging, or that as directed by your medical provider, you go and see a specialist, somebody who has a higher level of knowledge to help us figure out what's going on with your pain. And then we always need to involve mental health, and then look at the future medical costs once you've kind of hit the most improvement that you can within that time period. As always, if you're injured in an accident and it's not your fault, we would love to help you.